Welcome to Nursing Survival. I'm Nurse Camille, and in this episode, we're going to be discussing COPD. Go to nursingsurvival.com to get the study guide that goes along with this podcast. I even have fill-in-the-blank and coloring page study guides that will help keep you engaged while you listen. I also have videos on YouTube. COPD stands for Chronic Obstructive Pulmonary Disease. It is the chronic inflammation of the lungs. The bronchial airway or the alveoli are damaged due to inflammation. Alveoli are tiny air sacs at the end of the airway. They facilitate gas exchange with the blood capillaries. Emphysema occurs when the alveoli are damaged or destroyed due to inflammation or exposure to toxins. Chronic bronchitis is inflammation of the lining of the bronchial tubes. They are the branches that carry oxygen into the lungs. Both emphysema and chronic bronchitis are the two main contributors of COPD. With COPD, the air is easily breathed in but becomes trapped. The elastic recoil has been damaged. Patients have difficulty with expiration. The patient's anatomy changes due to the trapped air making the lungs bigger. The patient's chest may have a barrel-shaped appearance. COPD is a progressive disease, meaning that it will continue to get worse. More and more damage to the lung tissue will occur. COPD is caused by environmental exposures. Tobacco smoke is the number one cause. Pollution and exposure to toxins, such as coal, textiles, and asbestos, are also linked. Signs and symptoms of COPD include fatigue. The patient will easily tire. Daily tasks, as simple as eating or getting dressed, may wear the patient out. The patient will have a cough. It may be a persistent cough with lots of phlegm or mucus. They may experience shortness of breath. They may also use their accessory muscles in order to breathe. Wheezing is also associated with COPD. It is a whistling in the airway that indicates it is narrow or obstructed. Pursed lip breathing, excessive mucus, a barrel-shaped chest. This is due to the lungs increase in size due to the stretching of the trapped air. Dyspnea on exertion, orthopnea or shortness of breath when lying flat. Prolonged expiratory time. Remember that the patient can breathe in easily, but the air gets trapped. They have difficulty breathing out. Clubbing of the fingers, which is when the fingertips become widened or rounded. Frequent respiratory infections. Cor pulmonale is right-sided heart failure. Cor pulmonale is caused by an increased blood pressure in the pulmonary artery. The pulmonary artery is the vessel that carries deoxygenated blood from the heart to the lungs. The increase in blood pressure causes the pulmonary artery to enlarge and stretch. Weight loss is another symptom. They may also have tachycardia, which is a heart rate greater than 100 beats per minute. Diagnosing COPD is done through medical history and testing procedures. An arterial blood gas, or ABG, is a test that measures the oxygen and carbon dioxide levels in the blood. A patient with COPD will have low oxygen and high carbon dioxide results. ABGs will show up time and time again in nursing school, so make sure you can interpret the results. I'm not going to go through it in this episode, but we'll have a study guide for it. Remember that emphysema and chronic bronchitis are the main contributors of COPD, but they both affect different parts of the lungs. Symptoms and results will also be different. Patients with emphysema are sometimes called pink puffers. Their ABG results may show a normal CO2 and an O2 level greater than 60. It is near normal due to hyperventilation. Patients with chronic bronchitis are sometimes called blue bloaters. Their ABG results may show an elevated CO2 and a low O2. Cor pulmonale, or right-sided heart failure, will make the ABG result more pronounced, as the body cannot compensate as well. Another diagnostic procedure includes a spirometer. It measures how much air the patient can blow out over 6 to 10 seconds. The patient with COPD will have difficulty with expiration. A chest X-ray may show an enlarged heart, a hyperinflated chest, and any other chest abnormalities. A CT scan may show changes in the lung as well as cancer. Complications of COPD include pneumonia and frequent respiratory infections. A pneumothorax is a collapsed lung. It occurs when air gets into the pleural space around the lung. Pressure is used to keep the lung inflated, and this disrupts it, causing the lung to collapse. Acute respiratory distress syndrome, or ARDS, is a severe inflammation of the lungs that causes air to leak into the blood vessels in the airway. Lung cancer, depression, and osteoporosis are also complications of COPD. The patient may have impaired mobility. The patient may not have the energy to move around due to the poor oxygen exchange. Cor pulmonale is right-sided heart failure. The pulmonary artery is damaged, causing the right side of the heart to become impaired. Treatment for COPD includes medication and lifestyle modifications. Bronchodilators relax the muscles of the airway so air can flow better. Short-acting bronchodilators include albuterol. It works quickly and lasts 4 to 6 hours. It is taken when the patient has symptoms. Long-acting bronchodilators, such as tiotropium, last up to 12 hours. It is taken to prevent symptoms. Inhaled steroids help reduce inflammation in the airway. Examples include budesonide and fluticasone. Tiotropium is an anticholinergic that helps to open up the medium and large airways. Antibiotics may be needed if the patient has a respiratory infection. Oxygen therapy is important for patients with COPD, but they need to be careful. Too much oxygen can turn off the patient's drive to breathe. They need to use as little oxygen as possible to keep their O2 saturations above 88%. Nursing considerations for patients with COPD include improving the quality of life, slowing the progression of the disease, controlling symptoms, and preventing exacerbations. Oxygen therapy should be closely monitored. The patient's O2 sat should be around 88 to 92%. The patient may become anxious or stressed when they have difficulty breathing. Help reduce stimulations and reduce anxiety. Patient nutrition is very important. The patient may have difficulty eating due to fatigue and shortness of breath. They may only have enough energy to breathe, so eating becomes more of a chore. Encourage small, frequent meals and foods that are easy to chew. Chest physiotherapy is clapping or percussion over the patient's back and chest. This helps the mucus to move and hopefully expel it. Oral care includes frequent teeth brushing, chapstick, and moisturizing. Their mouths can get dry due to impaired breathing. Remember, the patient may have right-sided heart failure. Signs and symptoms include edema throughout the body, JVD, fatigue, ascites, and an enlarged liver or spleen. Patient education may involve discussing oxygen therapy with the patient. Encourage them to conserve energy by having small, frequent meals, spacing out physical activity, and taking rest breaks. Remember to keep O2 saturations above 88%. O2 therapy should be as low as possible, as not to turn off their drive to breathe. Inform your patient on the importance of quitting smoking. Tobacco is closely linked to COPD and will only make the disease progress faster. The tripod position is when the patient sits or stands, leaning forward with their upper body. The patient may find that it is easier to breathe in this position. Inform the patient to cough to help clear mucus from the lungs. Non-selective beta blockers affect beta 1 and beta 2 cells. They can cause bronchospasms, and they should not be taken by patients with COPD. Some examples include propranolol, nadolol, sotalol. Educate the patient on managing exacerbations. Encourage rest, O2 therapy, and medications. Instruct the patient on good nutrition. They should eat small, frequent meals, drink plenty of liquids, and have high-calorie meals. Thank you for listening to this episode of Nursing Survival. Go to nursingsurvival.com to find more study guides. I'd love to hear from you. Send me any topic suggestions and sign up for emails so you can be the first to find out when new study guides come out. Thank you.